According to a 2023 study by the National Council of State Boards of Nursing, nearly 1/5 of the country's 4.5 million registered nurses intend to leave the profession in the next few years. A major culprit? Burnout.
The Mayo Clinic says burnout can impact nurses' personal lives, the patients they care for, and their employers.
Reporter Kristen Crowley gives us an in-depth look at the ongoing nursing shortage and efforts underway to rejuvenate the workforce.
It was a time of fear.
Patients building up in all the corridors.
All of us are going to have to sacrifice.
Uncertainty.
Fearful of the unknown.
We're running out of equipment.
And exhaustion.
I feel so bad for nurses and doctors right now.
Tell me about what it was like being a nurse during the pandemic.
It was hard. I think it was something that nobody was prepared to deal with.
Lauren Syed was a nurse in New York City during the height of COVID.
It felt like I was risking my life to go to work.
She had started a new position as a care manager in a hospital 6 months before the world started shutting down.
And it was a really, really difficult time in my life.
Traumatizing?
Yeah. And I don't think I knew it at the time and really understood how much it affected me.
Now that she's had time to reflect, she says she knows exactly what it was: burnout.
What did burnout feel like?
It's just exhausting. It felt like it was taking everything in me to go to work.
Syed says the career she once loved turned into something she didn't recognize anymore. And in 2020, she finally had enough.
I just realized how much stress and how much pressure I had been under.
She left for a new state and a new job, a move that isn't all that uncommon. According to data from the National Council of State Boards of Nursing, about 100,000 registered nurses left the workforce during the pandemic due to stress, retirement, and burnout. They say nurses have been exiting the profession faster than they can be replaced, and the trend is projected to continue.
We are on the verge of a healthcare crisis.
Marianne Alexander, the organization's chief officer of nursing regulation, says issues with staffing and workload are contributing to an ongoing nationwide nursing shortage.
That puts extra strain and pressure on the nurses that are still in the profession.
How important would you say nurses are?
Nurses are the lifeline of healthcare. How can you have healthcare without nurses?
She says if not reversed, the repercussions could be devastating.
Hospital beds will have to close because we will not have enough nurses to care for all the patients.
Outside Boston, nurse Tana Bao says in April 2023, she left her primary care position because she felt overworked and unsupported.
I just want to be a good provider. I want to be able to provide good care to people, but it's really hard to do all that when you have all these time constraints and you have all these competing priorities and not enough time to get to things in the day.
She decided to take a step back from bedside nursing, but says she hasn't given up on the profession entirely.
For my mental health and my own sanity, it was definitely an easy decision.
To retain skilled workers like herself, Bao says the emotional and physical well-being of healthcare workers needs to be prioritized.
Trying to make sure your nurses feel seen and feel heard and feel cared for.
Now, hundreds of hospitals nationwide are working with Dr. Salome D. Good to do just that.
These types of practices of checking in and turning inward are so important for everybody in order to live a balanced and healthy life.
Her nonprofit, the Sufi Psychology Association, launched the Caring for Our Caregivers initiative in 2020, and word of mouth traveled fast.
Hospitals would call us and say, our nurses love this. Can we get it for our sister hospital?
In addition to offering in-person wellness workshops, the program has donated more than 1,000 tablets loaded with programs promoting relaxation, breathing, and movement.
It's about teaching them how to tap into themselves, how to check in with themselves, and to figure out exactly what they need.
Experts say education is also key to addressing the nursing shortage. The University of South Carolina and Lexington Medical Center are building a new state-of-the-art nursing simulation center and teaching space in West Columbia, which will nearly double the number of nurses the university can graduate.
This partnership with USC College of Nursing creatively helps solve one of the biggest challenges facing healthcare today.
And in New Orleans, LCMC Health and Chamberlain University have partnered to create the Called to Care Scholars Program, which offers eligible participants up to 3 years of paid tuition at the school for a 3-year employment pledge at LCMC.
We can graduate more nurses, we can impact the nursing shortage.
As for Lauren Syed,
and I've been able to really heal and recover as much as I can with just taking some space for myself.
Nursing isn't in her life anymore, but she says she's using her experience to help others, working to start a business mentoring women as they navigate the transitions in their lives.
And I feel like I've found my passion and my excitement again.
Something she says she hopes her former nurse colleagues can find again, for the sake of healthcare's future.
Recent studies in the National Library of Medicine find that nurse burnout is an occupational hazard that not only affects nurses, but patients and organizations too. It's associated with decreased productivity and worsening quality of care.
And it's not just nurses experiencing burnout. According to a recent AFLAC Workforces report, burnout impacted more than half of American workers in 2022. The Mayo Clinic says burnout isn't a medical diagnosis, but the psychologist we spoke to says it can cause physical symptoms.
Maybe we have a little bit of a nervous stomach, or we're distracted, or we get headaches, or we're feeling anxious and stressed. A lot of us feel that. Burnout is a little bit different. Burnout feels more like exhaustion. It can be physical exhaustion, but it's also mental exhaustion.
To combat burnout, the Mayo Clinic suggests you seek support to help you cope. Try a relaxing activity like yoga, meditation, or Tai Chi. Get some exercise, get some sleep, and practice mindfulness.